Medical research often takes decades to come up with a breakthrough. But for one family, the help came fast, thanks to a UCSF doctor. Fast enough, in fact, to save their daughter.
Garvin Thomas joins us now with this Bay Area Proud. Hi, Garvin.
Janelle, Jessica. Sobia Qureshi and Zahid Bashir learned the very hard way. They're both carriers for something called Pompe disease, a disease from which children rarely live past their second birthday. I say the hard way because they lost two daughters to the disease. But when Sobia was pregnant in 2021, they learned that child too had the disease as well. But thanks to a surgeon at UCSF, the result this time was very different.
Yeah. Ayla in all of her glory.
To be completely honest,
Yes.
squirmy 16-month-olds can pose a great challenge during a television interview. But with Ayla Bashir, all is forgiven because this little girl is the entire reason for the interview. Ayla is alive and as active as she is, thanks to a first-of-its-kind treatment pioneered by a UCSF doctor.
How do you thank somebody like that? You know, I don't know what to say, but we're just so grateful to her.
This has been a dream come true, you know, because, you know, why do we do anything we do, right? You want to make a difference in the world.
Probably have more CD45.
Dr. Tippi MacKenzie is a pediatric surgeon. 5 years ago, she says her team set out to treat a series of diseases, including one called Pompe, while the child was still in the mother's womb. It is something that had never been done before, and Dr. MacKenzie offered the treatment to Ayla's parents.
No promises. We literally said you would be the first in the world. We have no idea if this is going to work. What do you think?
Okay, how do we do this?
After having lost two daughters to Pompe in the past, Sobia and Zahid didn't have to think long about the offer.
It was amazing to know that there was maybe a possibility of giving her a better chance at life and a better quality of life. So yeah, like I jumped at the idea of it. Like, okay, how do we make this happen?
Well, not easily, as it turns out. Because of COVID, travel to San Francisco was off the table. So surgeons in the family's native Ottawa partnered with Dr. MacKenzie to administer the therapy. It has been, as you've already witnessed, a tremendous success. Ayla not just hitting microphones, but hitting all her developmental milestones.
Like, I'm glad it helps that she's part of the story here, right? Like, she's part of the success.
And a family who had been through so much medical heartbreak are getting to enjoy the benefits of a medical breakthrough.
And one note about the family, just because both parents are carriers, that doesn't mean all their children have Pompe. They actually have two other children, including a 13-year-old son who did not have Pompe. The doctors told the parents it was about a 25% chance
that it would
that
work.
a child would have
Pompe.
And so when they made the decision to go forward and have more children, they knew the odds, they knew the risks. Obviously, they knew the hard risks, but so fortunate for them this time that while Ayla had Pompe, it just so happens that this treatment was coming on board. First child in the world to get it.
Wow.
Thanks to a doctor at UCSF.
Doctor, for
Right,
sure.
and what awareness to know about this.
Yes.
And to help other parents know.
Yeah, it was their first question. Are there any advances since we went through this last time? And the doctor was like, now that you mention it,
Wow.
that's what you want to hear.
Promising. Okay, thanks, Garvin.